So we talked about briefly in the last video diabulimia, which is teens abusing or not taking their insulin. Actually, not teens, it could be anybody. Not taking their insulin so that they see that weight loss that's associated with their cells not getting the energy that they need. So what does a profile of somebody with anorexia look like? We see it mostly in adolescent girls, but 10% are male. False body perception, very ritualistic involving food. For instance, they might do things like rules that they need to chew their food 100 times before they swallow, or they have to cut their food up in very small pieces. They find security in this control. They're very competitive, so they look at what other people eat and they determine that they have more willpower. They're very preoccupied with food. And they may have a history of dysfunctional relationships. Oftentimes it is white, middle class, middle to upper class, firstborn, very competitive, very high pressure family that we'll see it with anorexia, but it really knows no boundaries. Things that we see would be this amenorrhea, which would be the absence of menstruation, and that's due to low body fat. So the body is no longer able to menstruate. Sleep disturbances, withdrawals from family or friends, excessive exercise, likes to make a lot of food for other people but doesn't eat, maybe hides or stores foods. And the appearance that we're looking at here is that skin and bone appearance. They're often very cold because their body temperature is lowered. Remember that fat on our body provides that insulation. And then, interestingly, we see the appearance of lanugo, which is like this fuzzy peach fur that covers the body, the face, the arms, the neck, the back. But on the top of the head, we'll see loss of hair related to nutrient deficiencies. Lower heart rate, decreased basal metabolic rate, iron deficiency anemia, rough, dry, scaly, cold skin, fullness, bloating after eating. Clinically, we'll see a low white blood cell count, and then constipation. At its worst, we can see changes in neurotransmitters, so affecting brain health, depression, anxiety, tooth erosion or loss, and then muscle tears and stress fractures in athletes. So what are we going to do here? Our goal is to normalize weight. We want to restore healthy eating habits. We want to delay or prevent any further weight loss. So oftentimes individuals are put in full hospitalization if they have less than 75% of their ideal body weight, they have some acute medical problems, and they're at risk of hurting themselves. But we also see things like outpatient therapy and day hospitalization. The multidisciplinary team that we're looking at is a nutritionist, a psychologist, counselor, art therapist, body image, family treatment. So it's not just as easy as them seeing a nutrition professional. Our nutrition therapy goals are to prevent further weight loss, restore appropriate food habits, and then ultimate weight gain at 2 to 3 pounds per week. So you could see for someone who has a very distorted body image and intense fear of becoming overweight, that this weight gain of 2 to 3 pounds per week could be terrifying. Some things that we can look at here, like we talked about, medications, family therapy, cognitive behavior therapy. Let's contrast that then with bulimia nervosa. So bulimia nervosa is episodes of binging and purging, and your text talks about the diagnosis of bulimia nervosa, and that is frequency of binge eating episodes and then inappropriate compensatory behaviors to counter that binge. And that's 2 cycles per week for at least 3 months. Here's a profile of a bulimic, typically young, usually female, but more and more we're seeing eating disorders in males as well. Might be at their